Anesthesia options for facelift surgery. One of the most common questions my patients have. So there's basically three options for anesthesia. From the least to the most invasive are local anesthetic, twilight, and general. So let me discuss a little bit about each of these. Local anesthetic is something similar to lidocaine. It's a local anesthetic that gets injected into the area that's going to be treated. And all it does is numbs up the skin so the patient doesn't feel any discomfort. Now, for dentistry, it's a great choice. For facelift surgery, in my opinion and in my experience, it's a terrible choice. It's not powerful enough, and then you can hear everything that's going on around you. And for facelift, it's not very comfortable for patients. So, in my experience, local anesthetic is a terrible choice for facelift surgery. The third option, general anesthesia, is the most invasive one. In some cases, it's the best option for some patients. And this is traditional anesthesia where there's a tube that gets inserted down your throat and there's a machine that's helping you breathe, and the anesthetic is provided with a gas type of anesthetic. This one has a little bit of a longer recovery and there's an increased risk of nausea after surgery. The second option, which is the last one I will discuss, which is probably the most common option and probably the best for most patients, is what we call twilight anesthesia. So twilight anesthesia is the combination of using local anesthetic to numb up the area that's being operated on. And then the patient gets an IV in a relaxing medication such as propofol, which is what they use for colonoscopies, is put through the IV. Now, this is a great combination because the local anesthetic will numb up the area, and then the medication that's going through the IV will make you sleepy. Sleepy enough for you to not feel anything that's happening during surgery or for you to remember, but light enough for you to wake up quickly after surgery, which is really the advantage of this anesthetic. Recovery is much faster. Once the anesthesia gets turned off, you're fully awake, and the risk of nausea is much less than with general anesthetic. So again, for most patients, twilight anesthesia with the use of local anesthetics is the best choice for facelift surgery.